COVID-19 numbers have increased in the UP since the beginning of the month. Today, I spoke with Western Upper Peninsula Health Department's Robert Van Houw on the virus, vaccines, and if the Delta variant is cause for alarm in the Upper Peninsula. Take a look. COVID-19 numbers have seen a recent uptick in the Upper Peninsula. There have been outbreaks in Gogebic County and Chippewa County, as well as smaller increases around the state.
The pandemic is far from over because in our region only about half of people are vaccinated, which means they're susceptible to get the illness, and that when the illness comes through, they can get it, they can get sick, they can end up in the hospital.
And with the Delta variant on the rise in the United States, it begs the question of whether or not this more severe and contagious strand is the cause for the increase in cases.
Michigan has not seen much of the Delta variant, which is much more contagious and leads to more severe illnesses.
Even with the one confirmed case of the Delta variant in the UP, Van Houw says most COVID tests are not currently being genetically tested for that strand.
Only the cases where there's a consideration that it might be the Delta variant are we sending it for testing to the state lab, and it takes about a week for it to get the results from the state lab.
Finally, Van Houw mentioned that Michigan history serves as the warning sign of potential spikes in the virus.
In 1918, when they had the swine flu epidemic, the first year was very similar in Michigan to what we just saw this past year, with spikes around the same time. Then there was a gap in the disease, and then the next December and January was the biggest spike of all. So we could easily have another outbreak this coming winter if we don't have enough people in the area vaccinated.
For ABC 10 and CW5 News, I'm Marta Berglund.